two big needs. First of all, of course, is physical health, but also spiritual health. And that's exactly what this organization is doing. It has been doing for so many years, and Georgia herself is the saint for this organization. We're so proud of her for having started this. It's wonderful for what she has accomplished for senior citizens as well as for youth. And I'm happy to be a part of it, and I hope to remain a part of it. And I'm very proud of Don for having stuck with it, because he's had a lot of challenges, but he's managed to keep himself together.
There's no greater work one can do than to promote good health and health care. I don't care how wealthy you are. I don't care how accomplished you are. I don't care how much money you got. If you are sick, you're not in good shape. So this is outstanding work. I commend Don Doty for doing it. And Don has been the main educator in the state of Illinois, pushing the issue of hepatitis and the issue of HIV and AIDS, and has helped to educate thousands and thousands and thousands of people so that they know how to better protect themselves.
Don is a pillar of the community as founding president and CEO of the Georgia Doty HIV and Hepatitis Community Outreach. I especially appreciate all of your good work to raise awareness about hepatitis and HIV within communities of color. I have worked in Congress to support your efforts. I have spent my career in Congress working to serve the communities I represent and to protect the least among us. As long as God continues to give me good health and the people continue to give me their support, I look forward to continuing that work.
And good evening. Welcome to the Doty Report. My name is Cheryl Garrett Lee, and I am your host this evening. The Doty Report is an outreach venue for Georgia Doty Comprehensive Health, which you have just seen some of the great moments that Georgia Doty is involved with. Georgia Doty Comprehensive Health is a not-for-profit whose mission is to help in communities that are challenged with economic and health disparities, particularly veterans and seniors. We help with employment issues, homelessness, feeding the homeless, helping with HIV, AIDS, hepatitis C, diabetes, cancer. There's so much that is done through the Georgia Doty Comprehensive Health Organization. Our president and founder, Don Doty, is a Marine veteran himself, as well as we want to shout out to Don Doty, to Joyce Doty, his lovely wife, who's always by his side, and to the Georgia Doty Comprehensive Health team. So tonight for you, we are in times that are just, we don't know what to do. We don't know where to go. But we at Georgia Doty Comprehensive Health know that one of the greatest things that we can do is educate ourselves about what's going on in the world today. And right now, everything is so focused on COVID-19 and the pandemic and what all the things that are surrounding it. So tonight, we'd like to have a very frank and honest discussion with you about the COVID vaccine, because it is a major issue right now. And with the introduction of the booster, everybody has questions. There's some uncertainties. People want answers. And so tonight, we have for you an expert. And this expert, you will be able to call in during the show and ask questions. So think of your questions. We want you right now to pause, get a friend, text a friend, call a friend, tell them, come on in, tune in. This is the time where you will be able to ask your questions. So, as it says on the screen, please like and share right now before we bring our guest on. So, tonight we have with us a true powerhouse for the times that we are in, and that is Dr. Wilnise Jasmin. And she is the medical director of behavioral health at the Chicago Department of Public Health. Dr. Jasmin, hello, good evening. How are you tonight?
Hi, good evening. Thank you for having me on tonight.
Thank you. And let's talk a little bit more about your background because truly you have such a great fit of skill set for the times that we live in right now. I was reviewing it and I think it's just marvelous that we're able to have you on tonight. Very honored to talk with you. Um, she belongs to the leadership team who is responsible for the city's initiatives in the areas of violence prevention, substance abuse and prevention, and mental health. Now, for the COVID-19 response, he worked on providing safe isolation housing for residents who could not safely do so on their own, and the health department's lead on initiating Chicago's water-based epidemiology project to serve as an early warning sign for the detection of SARS-CoV-2. She specializes in both preventive medicine in the public health sector and family medicine. She is an alum of the Johns Hopkins Bloomberg School of Public Health and the Cook County Loyola Family Medical Residency Program, where she serves as chief resident during her final year. She currently is a UC Irvine Primary Care and Psychiatric Fellow and serves as its chair for the American College of Preventive Medicine's annual conferences, Population Health and Health Systems Track. So this evening, I bring to you Dr. Jasmin. We have so many questions for you tonight because your background spans from, helping the public with their concerns about COVID-19, SARS, things like that. But also you have a sector in there where you help with violence prevention and substance abuse and prevention. And all of that has been very prevalent in our times. Now, tonight we want to talk specifically about the hesitancy of the COVID vaccine, but I'd like for you just to tell us a little bit more about yourself and how you have been involved with these things.
Yeah, so for me, I've worked for the health department for a little bit over 2 years now. And I guess it was baptism by fire when it came to joining the COVID response. So before I fully got acquainted with all the functions of the health department, I really, with the COVID response, got to learn about all the different bureaus in the health department. And so I'm happy to be here and talk about a lot of our work. You mentioned that I help with the substance use and prevention programs here. So what we do is not only fund providers who provide medication-assisted therapy, residential programs, outpatient programs, but we're also looking to fund organizations that have innovative ways of trying to reach people with substance use disorder. And so we work with a lot of the outreach workers who are on the ground, providing trainings to how to use Narcans and talk about harm reduction. And then when it comes to violence prevention, we work with organizations that provide services to people who experience different kinds of violence, and also working with their families because we know it's a traumatic event, and any support that we're able to provide to them, we try to make the resources available.
Awesome, awesome. Now, I know that you are, the medical director for the behavioral health aspect of things, and Georgia Doty is involved with the grassroots efforts. As a matter of fact, during the entire COVID time, we have been very fortunate to be able to get out in the communities, distribute PPE. We've been distributing information and pamphlets, able to work together with different community organizations so that we could help the communities and reach out. And one thing that I noticed as we were always out there, there's always questions about the vaccine. What have you seen regarding that, Dr. Jasmin?
Yes, so questions, they come all day, and I don't mind answering them because this is a uh, new virus now. Almost 2 years it's been around, but as the scientific community is learning about the virus, we're sharing that information in real time. And so the more answers we have, the more questions arise. And so one topic that you brought up is this topic of vaccine hesitancy. And I know for the World Health Organization, they consider this a significant health concern. And they define it as a delay in acceptance or refusal for the vaccine despite its availability
Mhm.
or of the vaccination services. And so I want to acknowledge that hesitancy is a complex issue. And and when it comes to addressing it, it's really on an individual basis at this point. And so that's why I'm glad I'm here today. And I encourage your audience to call in and ask the questions. I'm happy to answer every question that's asked of me today.
Okay. Well, let's dive into some things. Because with the COVID vaccine, there are people who politically stand on one side of the fence, pro or con, because of their political views. Some people have religious views. Some have even said perhaps this is 666. We have people who may be pregnant or anticipating getting pregnant, so they're afraid of what might happen. You have people who bring up things like the Tuskegee incident, where they were used as an experiment, really, and it was just a horrible situation. So there's so many fears, I think, that are underlying this. What would you say to those? What direction and guidance can you give people who just because of all these different concerns and factors that are bringing about these fears? What would you say to them?
Well, one, I would say your concerns are valid. I know, as you brought up Tuskegee, that has been talked about a lot in recent years, especially recent months.
Mhm.
And those experiments did happen. We have to acknowledge that. I do want to say that um, in medicine now, we are trying to be as transparent and very patient with explaining the whole process. And so when we talk about the vaccine, another area of concern that some people might raise is how quickly the vaccines were developed. And we know that no steps were skipped. But because there are multiple steps in developing a vaccine and getting it approved, some of those steps were done simultaneously instead of one after the other. And that's what would allow the scientists to shorten the amount of time that it would take for it to be available for the general public. But ultimately, as the patient is the final and ultimate decision maker. And for me, I see it as my role is to provide the resources that are accurate in order to help you reach that final decision.
Okay.
Mhm.
And so now we're at the point where we're doing the booster. And I
Mhm.
myself, I work in a health clinic, and I saw just hundreds of people dive in when we first started, giving the vaccine. There were just wait times, appointments were set and everything. And so now we've got calls, and I'm sure everybody's got calls, and they're trying to answer questions about the booster. So
Mhm.
people are, should I take it? Should I not take it? Why do we need a booster? How often will we need a booster? Can you address some of those concerns?
Yeah. So right now, the CDC they recommend for those who should receive the booster if they're 65 years or older or live in a congregate setting, like a long-term care facility. Also, those who are between 50 and 64 and have an underlying health condition, the CDC also recommend those who fall in that category should also receive it. And then for those who are under 50 with underlying health conditions, the CDC says that that group may also receive the booster. And
Mhm.
then for those who work in settings where they're exposed to people who are COVID positive, those people should also get that booster to add that extra layer of protection.
Okay, great. That's
Mhm.
a great answer to those questions, something everybody can just very clearly understand. The second thing I want to ask you now, people are, information comes from all kinds of sources. What recommendation would you give for people if they are researching, if they're trying to figure this whole thing out? Where would you direct them to find this information out?
So the CDC website is one good resource. Another, if you're a Chicago resident, even if you're not living in Chicago, if you go to chicago.gov/COVID vax, that website is hosted by our health department, and we have a lot of resources regarding the studies that took place for the recommended vaccines. Also, there's a section for frequently asked questions to address concerns. That website also has locations for where a person can receive the vaccine. And then when you actually do show up, you can speak to a healthcare professional to have your specific questions answered before you make that decision as well. So chicago.gov/COVID vax.
Great, great. Now, what would you say is maybe give us three main concerns that people have, that they are maybe the first top three things that they should consider when they're thinking about the vaccine?
Well, some people are really anxious about possible side effects.
Mhm.
So for some people, when they receive their second dose or even their first dose of the two-dose series, which is the Moderna or the Pfizer vaccine, some may have felt like feverish or chills or had some mild aches. And for me, I always say anyone who experiences those kind of side effects, I reassure you that they are mild and that they can be helped if you take like Tylenol or ibuprofen to help you with that uneasiness you're feeling. Ultimately, having COVID itself it can be a lot more painful. When you are deciding about getting the vaccine, even if you don't consider yourself a high risk for becoming severely ill, there may be other people in your life who may be at risk. And by vaccinating yourself, you're protecting them as well.
Mhm. That is such a great thing because we know that many people are kind of asymptomatic, but they are able to spread COVID to someone who it may be detrimental to, and fatal even. And so you also deal with behavioral health.
Yes.
Now that is a major area too. There are some people who have conditions that create great fear surrounding vaccinations, um, concerning this whole COVID situation. What would you suggest to their family members or friends that can assist those who may be having some behavioral health challenges?
Yeah. So for us, the city of Chicago, we launched this mental health literacy initiative called Unspoken. Because oftentimes when people when they're thinking about mental health condition, it's like this big elephant in the room. Everyone knows it's there, and then sometimes it's not addressed directly. And so on the website, people will be able to find their closest mental health patient clinic where they can seek care from a therapist or psychiatrist. It also talks or shares a story of real Chicagoans about their interactions with the care they received and how it impacted their lives. So, for someone who may be experiencing something like anxiety, one thing I could say is that the this past experience with COVID, all the changes we had to go with our lives, is absolutely natural. That all we are experiencing this kind of anxiety. Um, One way to deal with it is to speak to family members. Sometimes you also can benefit from help with a therapist as well, because
Mhm.
a therapist, a professional, can provide you with exercises that will help you manage the anxiety levels. Oftentimes, even if the person's not anxious or recognize their symptoms as being signs of anxiety, other manifestations of stress may include change in sleep patterns. So before this pandemic, were you sleeping a lot less or a lot more? And sleep has an effect on so many aspects of our health. And so we can also think about addressing sleep hygiene. So making sure that an hour before you go to sleep, you're not in front of a bright screen. Making sure that your bed, you only sleep in your bed. You don't eat in it, you don't read in it, you don't do your homework in it. Your bed's only used for sleeping. So your mind already knows, okay, it's time to go to bed once you're in the bed. Sometimes taking a warm shower can also calm you down before sleeping, and not exercising too vigorously right before bed. So things like that can also be helpful.
So I shouldn't do those skinny pop snacks, skinny pop popcorn snacks while I'm in bed.
Because you may associate it with being hungry instead of being sleepy.
Right. Exactly. I know it's a no-no, but I do it anyway. I want to switch gears a little bit because this has been such great information. And for our viewing audience, we just thank you so much for joining us this evening because this is a very relevant topic today. And so I want to take time out just to recognize those who we've lost to COVID. We definitely hold you dear in our memories. Those who have been victorious in their COVID fight, we salute you. And those who are in the struggle right now, we encourage you to keep going. If you have family and family members, or you're just curious about things, or you want some information, I suggest that you get in touch with Georgia Doty Comprehensive Health. You can go to our website at georgiadotyhealth.org, or you can call us. There should be a number that will be provided for you this evening. Feel free to call us. We are in the grassroots efforts of helping the communities and making sure that you get the information. We have great resources such as Dr. Jasmin, um, who we can direct you to, others, brochures, pamphlets, anything that you need to help you in making the right decisions. Dr. Jasmin, I'd like to talk a little bit now about those who have gotten the vaccine and then they got COVID again. They got COVID after the vaccine. I think that that is another thing that puts the hesitancy in the minds of some people who are not vaccinated. Well, why should I get the vaccine if I might get it anyway?
Okay. No, that's a legitimate question because I hear that story repeated in the news often. Um, I could tell you for the people who have been hospitalized with COVID, the great majority of them, over 99% of them, have not been vaccinated. So it's
Mhm.
about 1% of people who are sick in the hospital with COVID who have been vaccinated. Very
Wow.
small. So it's the great majority of people who have been vaccinated, again, close to 99%, they don't get sick with COVID. And for those who do have that breakthrough infection, they tend to be milder symptoms. Um, but even though it is repeated often in the news, reality is that vaccine does protect you, and it does increase your chance of avoiding getting COVID.
Great, great. I think that we have a viewer question.
Yeah.
I'm just waiting. Okay, here it is. Here's the question that we have. And thank you for your question. Will you have to take a booster shot every year or every other year?
That's a good question. So right now, the CDC hasn't made recommendations about whether or not you'll need a yearly one or every other year booster. Because we're taking it one season at a time. We know that right now we're recommending the booster as a way to increase everyone's immune system. The less chance we provide the virus to infect an individual, the less chance the virus has to mutate and develop new variants. And so it's possible that it may be something like the flu shot, which you do need to receive every year, or it could be possible where after this booster, you may need it maybe every few years, sort of like the tetanus shot. But right now, time will tell. I don't have a definitive answer for you. I wish I could have a definitive answer right now.
Sure, sure. I think we wish that we could have a definitive answer to a lot of things. And I think we as the human race have to realize that everybody's going through this. Healthcare
Mhm.
providers, everyone is going through this. It's something brand new. We haven't been through it before. So we don't have all the answers. And we kind of just have to walk through it and just be prepared. Um, for what is coming and just trust that everyone has the best intentions at heart.
Mhm.
So now we have a comment that someone would like to be addressed. It's that this is from Gloria Miller. Hi, Gloria. Thank you for joining us today. Dr. Charles Hoff found 62% of patients who received COVID mRNA jet lab test positive for blood clots.
I
Is
know
that
with the Johnson and Johnson vaccine, so that vaccine is not the mRNA vaccine. So the Pfizer and the Moderna are the mRNA. It was with the Johnson and Johnson that there was a pause, if you recall, earlier in the year in administering the vaccine because they found that there were a number of women who had developed blood clots in their brain. They paused the administration so that the FDA can review all of the cases to see which ones could be attributable to the vaccine. After a review of all of the cases, they showed that it was about a 1 in 1 million chance that someone with the J&J vaccine would develop this same blood clot in the brain. When it comes to the Pfizer and Moderna vaccine, which is the mRNA vaccine, um, they haven't shown a correlation with development of clots. Those who are positive for COVID in general, they are at increased risk of developing blood clots and that's why for those who are hospitalized with COVID, part of the treatment regimen is to give them blood thinners so they don't develop those clots.
awesome? Awesome.
Mhm,
And so I see that we have another viewer question.
mhm.
This is from Lauren Providence. Hi, Lauren. Thank you for joining us this evening. Lauren has also devoted quite a bit of time to Georgia Doty sometimes, so I recognize the name. There's talk about a pill. Do you have more information regarding the possibility of a pill?
Well, it's a pill that is an antiviral medication. And I know the FDA is reviewing the data to see if it will shorten the course or if someone were to be positive with COVID to prevent them from developing that severe version of the sickness. But right now, it's under FDA review. If they do find that there's enough evidence that shows that it is effective in preventing severe outcomes, you might see a similar process that we saw with the vaccines, where there will be an emergency use authorization in order to allow its use. And then as more people use it and more data is accumulated, then maybe later on it might be have FDA approval. But currently, right now, it's just under review. It's not available unless you're in a specific study, clinical trial looking at its effectiveness.
I love that question because it's like we're looking for options to the
Mhm,
vaccine and things. I love that question.
mhm,
I'd like to ask, thank you, Lawrence. Great conversation. We appreciate that. Yes, Dr. Jasmine, it's very beneficial to be able to have someone to sit and talk with directly about it and ask questions where we may not always have that opportunity. I want
mhm,
to switch a little bit now to the children. That has been a big issue as well. Children have started returning back to the classroom.
mhm.
Um, and there are so many questions that parents perhaps tonight have about the vaccination for children. What type of information can you give us on children being vaccinated and what age groups?
Yeah. So right now, it's the Pfizer vaccine that is approved for children 12 and older. For those who are between 5 and 11 years of age, the FDA is reviewing the data to see if the Pfizer vaccine is also acceptable for use in that age range. What's different about this age group is that they're looking at administering a lower dose of the vaccine, and they're trying to figure out what amount of the vaccine is effective for this age range. So that's what's causing the delay a bit. Because safety is always at the forefront of the vaccine rollout, we slowly look at younger age groups. So we start off with the adults and then move on to the adolescents, moving on to the younger adolescents, and then the children and toddlers. And so that's why we don't have full approval for all age ranges yet. But I suspect that we should be hearing something soon next month regarding Pfizer. Moderna also is under FDA review for this age range as well. And so we may hear something in November or December regarding Moderna and Johnson & Johnson.
Great, great. Now, let's say a person has experienced COVID, they went through the whole ventilator, hospitalization, all of that. What would you say to them regarding the vaccine at this point if they didn't have it before?
Yeah. Well, I would still recommend that someone who's had COVID before still receive the vaccine because the vaccine has a controlled dose, and we know the immune response to the vaccine. For those who are sick with COVID, the immune response can be variable. And right now, we don't know how long this immunity would last, the natural immunity from those who are positive with COVID. Also, sometimes those who had severe COVID, or even if they didn't end up in the hospital and were positive with COVID, they may develop this syndrome called long-term COVID or long hauler syndrome. And there have been reports of people who had this long hauler syndrome who received the vaccine, who then their symptoms improved. So things like memory trouble, the sense of taste. Some people felt like they couldn't breathe as well. Some also talked about having tingling sensation in their hand due to long COVID, and those effects were improved with the vaccine.
Great.
So, yeah.
Great. Now, let's just say there are people out there who are just not going to agree to take the vaccines. What precautions would you recommend for them?
Yeah. So for those who who have their mind made up, they won't receive the vaccine. That is your decision. However, there are infection control measures that we've been talking about since day one. They still apply to you. So continue to wear your mask and to make sure your nose and your mouth are covered. Make sure you wash your hands frequently. And it is especially important for those who are unvaccinated to keep that safe distance of 6 feet so they're not exposed to the virus as well.
And also, I wanted to ask you, Dr. Jasmin, there is that sector, the 20s and the 30-year-olds who maybe got it and they got very light symptoms. What would you say to them? How would you address them about this matter?
Yeah. So again, I still would ask that they also consider getting the vaccine and think of it in terms of protecting this age group. They may also have children. So they may have children that aren't eligible for the vaccine. It's a way to protect them. They may be taking care of their parents who are older, who's a vulnerable group. So also receive the vaccine to protect that age group. A lot of businesses are mandating the vaccine as well. So it may also help you keep your job because we've heard some of them making it 100% requirement. So for those who are still in that age group too, you may be busy living your day-to-day life and maybe just procrastinating getting the vaccine. Not on purpose. It's just as the days come on, you have other priorities. So there is a at-home vaccination program that you can still visit chicago.gov/COVIDvax to arrange to have a community paramedic come to your home and they'll vaccinate you and also up to 10 people in your household. And they're also providing gift cards of $100 to those who receive the vaccine.
There you go. Some Christmas money. You can get your vaccine as well. That's really good information. That's good to know that they can be vaccinated at home. Now, how about the consideration of there's offerings of Pfizer and Moderna? Which one do I get? How do I decide which one should I go for?
Say the one that is most readily available. So if you go to your primary care doctor and they only have Moderna, then get Moderna. If you go to your pharmacy and they only have Pfizer, then Pfizer, it's fine too. So they're both very efficacious, and I would recommend all the vaccines. There are some people who say, no, I only want to be to receive the vaccine once, and I'm not coming back for a second dose. So then get the Johnson and Johnson, because that's just.
Okay, good. Now I want to get just a little bit more personal with you, Dr. Jasmin, ask you a couple of questions because of your background, and we heard it as I read it off at the beginning of the program. Because your background, I mean, it's just so perfect for what we're going through right now. I mean, everything that you're involved with. How did you feel when the pandemic came on with the skill set that you have? Do you feel like you were called to this purpose? I was looking at your background. I'm like, wow, how did she just feel about everything?
Well, I thought that this was a great opportunity to share information with those that I encountered. So early on, I was also involved with a lot of the case investigations. So if you're hearing in the news about the nursing homes that were having these outbreaks, for me, I was going into the homeless shelters that were experiencing outbreaks. And the first thing I would immediately notice is this high level of anxiousness and fear. And so I think for me in general, I have a naturally calming demeanor, but also sharing with people, in addition to the infection control practices, ways that they could decrease their stress levels immediately. So sometimes I would practice breath exercises with the staff and also some of the clients in those facilities. And then just to empower the staff, even though they're not medical providers, this whole year has been an intense tutorial on different medical conditions and just making sure that they understand the information and that they're able to share that information with their clients. I think that my skill set helped with that project and having other people being able to learn and also share the information they just learned.
Right. I want to say, though, we're so appreciative of your background and everything that you have. I mean, being the medical director, being female, being minority, I think it's just awesome. Personally, I just applaud you. And I know that we at Georgia Doty, Don Doty, was just excited that we could have you on the show. We as his team, we were really excited because of your background. And anyone nowadays who has expertise in this area to help us along with it, it's really, really important. Yeah, and I want to encourage our viewers tonight. If you have not asked your question, there's no dumb question. You don't even have to put your name on there if you don't want to. But if you'd like to ask some questions before we wrap up, I encourage you to do so. You have now here the expertise of Dr. Wilnise Jasmin, who has joined us. And for those of you who may have tuned in a little later, she's the medical director of behavioral health at the Chicago Department of Public Health. And I see, shout out to Yolanda Givens. Yolanda Givens was the previous host of the Doty Report, and she's on watching us. Thank you, Yolanda. Yolanda had done just a fabulous job for us in everything that she did with the Doty Report. And she has gone on and she's still in the industry and she's written a book. So there's so many things that Yolanda's working on, so many projects, and we're really proud of her as well. Been with Georgia Doty for quite a while. And thank you, Yolanda, for tuning in tonight. Finally, I'd like to ask you, what would you say just to people in general right now? Doesn't matter what their political beliefs are, what their religious beliefs are, what their neighbors are saying. There are so many rumors surrounding all of this, and just anxiousness and fear. Along with what you would say to them, can you give us a little bit of some people have shut themselves in, especially the elderly. They want to stay away from it as much as possible. They've limited their activities. We all pretty much have. What kind of activities would you recommend for us? And what would you suggest us in going forward as we try to get out of the pandemic?
Hmm. Yeah, so being at home has really, for some people, made it hard to readjust to re-enter into the world and being around people. So for those who are still hesitant to be close to others, I still encourage you to go out and take a walk and feel the sun on your skin. Even if it's by yourself, if you see a group approaching, you can cross the street. But having a set time and establishing a routine where where you are physically active, that also improves your mental health as well. There are also resources where you can call or go on the Chicago Department of Health's website, and you can also speak to a therapist, where you don't necessarily have to go into one of our clinics or one of the clinics that are in Chicago. There are options where you could have telehealth services, either through your computer or on your phone, if you're a bit anxious about being one-on-one with an individual. Again, if you have a primary care doctor, primary care provider, please go and visit them as well. So the clinics, they really do know how to keep people safe, but it is important to get your routine health maintenance completed and to catch up on the screenings you may have missed during the year as well.
Okay, great. That's awesome advice. So I want us all to take heed to that and make sure that we pay attention to all of that and do what we're supposed to do. Take care of yourself. That's the important thing. Take care of yourself. Be smart, be wise, and take care of yourself. And then think about those that are around you, those that you're interacting with. Dr. Wilnise, Jasmin, we appreciate you so much today and all the wealth of information that you've given us. It's really important that we are able to continue to provide information, provide masks, provide gloves, hand sanitizers, and things like that. Organizations such as ours, as Georgia Doty Comprehensive Health, we can continue to provide this information for you. We can continue to do these grassroots efforts. We reach out to the homeless. We have been providing food every month to those that are homeless or those who are underserved communities. And just getting information out there, providing the Doty report. We also have a national publication called the Georgia Doty Comprehensive Health Publication, and our food drive, feeding the homeless and those that are in need. So, and the way that we do that is by your dollars, by your volunteering for our organization, and by your contributing to us and helping us. If you're an organization or an individual, please, you may support us through paypal.me/Georgia Doty, or visit our website, georgiadotyhealth.org. We thank you tonight for joining us. Please join us on next month, the second Tuesday of the month, and we'll look forward to seeing you, where we'll be talking about mental health issues in today's climate. So we look forward to seeing you. Thank you, Dr. Jasmine,
You're
and
welcome.
everyone have a lovely evening.